Assalamu alaikum. I'm Dr. Noushin Rahman, Assistant Professor of Department of Pathology, Bashundhara Ad-din Medical College. Today I'll be continuing my previous lecture. As we know, inflammation are two types. One is acute inflammation and second one is chronic inflammation. Acute inflammation is relatively short duration, lasting for minutes, several hours, for few days, and its characteristics are the exudation of fluid and plasma protein and the immigration of leukocytes, which is predominantly neutrophil. Stimuli for acute inflammation are infection, which is most common, tissue necrosis, foreign bodies and immune reactions. Components of acute inflammation. There are three major components of acute inflammation, which are alteration in vascular caliber that lead to increase in blood flow, structural changes in microvasculature that permit plasma proteins and leukocytes to leave the circulation, and immigration of leukocytes from the microcirculation and their accumulation in the focus of injury and their activation to eliminate the offending agent. The major local manifestations of acute inflammations compared to normal. In second figure, we can see there are vascular dilation and increased blood flow, which causes erythema and warmth, extravasation and extravascular deposition of plasma fluid and proteins, which is known as edema, and leukocyte immigration and accumulation in the site of injury. Acute inflammation has two events, that is vascular event and cellular event. Vascular event comprised of hemodynamic changes and alteration in vascular permeability. On the other hand, cellular events composed of exudation of leukocytes and phagocytosis. In vascular event, there will be transient vasoconstriction immediately, then vasodilation of arterioles, venules and capillaries obviously within half an hour of injury, then increased blood volume in microvascular bed which causes redness and warmth, elevation of hydrostatic pressure which results in transudation of fluid in extracellular space which causes swelling. Now, increased vascular permeability causes increased concentration of RBCs, which causes raised blood viscosity and slower blood flow, which is known as stasis. Slowing followed by leukocyte migration, mostly neutrophil, to the vascular endothelium. Leukocytes then move and migrate through gaps between the endothelial cells in the extravascular space, which is known as immigration. Now, reaction of blood vessels in acute inflammation. In short, there are changes in vascular flow and caliber which composed of vasodilation, increased permeability of microvasculature, engorgement of small vessels with slowly moving red cells which is known as stasis, blood leukocytes principally neutrophil which accumulate along the vascular endothelium, then increased vascular permeability and responses of lymphatic vessels and lymph node. Now, increased vascular permeability, which is also known as vascular leakage, is caused by contraction of endothelial cells resulting in increased interendothelial space, endothelial injury resulting in endothelial cell necrosis and detachment, and increased transport of fluid and protein which called transcytosis through the endothelial cell. Endothelial cell contraction is a reversible process which is mediated by histamine, bradykinin, leukotrienes in a short duration 15 to 30 minutes, structural reorganization of cytoskeletal of endothelial cells, reversible retraction at the intercellular junction which is mediated by cytokines such as interleukin 1 and tumor necrosis factor. Endothelial injury or direct injury to endothelial cell. Cell necrosis and appearance of physical gaps. Process of thrombosis is initiated at the site of damaged endothelial cells, which affects all level of microvasculature. Now, leukocyte mediated endothelial injury, adherence of leukocyte to endothelium at the site of inflammation, activation of leukocyte which release proteolytic enzymes and toxic oxygens causes endothelial injury and increase vascular leakiness. Neovascularization, newly formed capillaries under the influence of vascular endothelial growth factor, process of repair in tumors are excessively leaky. Thank you for today.